Brian Huber is a runner. For years, seasonal allergies would stop him in his tracks.
You normally notice right away what it is. I mean, it normally takes a half a mile to a mile to really loosen up, but at that point in time you realize that, hey, I'm having a problem here. Breathing is harder than I thought it would be.
Brian's primary care provider referred him to Dr. Gailushas at Mercy's Ear, Nose, and Throat Clinic.
He had some polyps obstructing his sinus going to the forehead. You can see this pathway is blocked.
Those blockages were keeping Brian from breathing freely.
He had several different issues we were addressing. At the heart of it is definitely allergies. So sinonasal allergies were a problem he was dealing with, but they had been going on long enough that they were causing him to develop nasal polyps and nasal obstruction. Polyps are a response to the allergens, and they're just growth in the nose that are benign but can block the normal pathways of the sinuses, preventing their flow.
Dr. Gailushas performed a minimally invasive in-office procedure called balloon sinuplasty to open up Brian's nasal blockages.
We were able to use some of these technologies to open up those sinuses, remove some of those polyps that were in the way, all in office, and allow his sinuses a space to heal.
Using a 3D virtual camera, Dr. Gailushas can pinpoint the area of the blockages. He then uses a guide wire to enter that space, as you can see on this model.
So with this system, it allows us to enter the sinus in a minimally invasive way. Our guide wire is able to track through the opening to the sinus, following up into that sinus as you see right here. And then along that wire, we're able to deploy our balloon, which follows the wire up into the sinus and then allows us to dilate that opening and open that sinus up so it can breathe.
This is just one of the navigation technologies developed in recent years and offered at Mercy's ENT clinic. Doctors use a patient's CT scan to build a 3D tracking model that guides them during sinus operations.
And I just love when people can be free of symptoms, they can breathe, and they're really enjoying their life. At the Sinonasal Center at Mercy Ear, Nose, and Throat, we're able to do that for people. We're able to help them. We take their unique issues and we are able to use these technologies tailored to their specific needs to improve their quality of life, improve their breathing, improve their symptoms, and help their sinuses, and I love it.
Brian had his procedure done in office on a Friday and was able to return to work on Monday morning.
You never realize when you can't breathe how difficult it is, and then once you can breathe, it is just like a huge weight has been lifted off your chest. And really, in the grand scheme of things, it's a pretty simple procedure with unbelievable rewards.
For more information, visit mercycare.org/ENT.